This is Mr. DOGRAMACI, consultant ophthalmologist and vitreoretinal surgeon at Princess Alexandra Hospital in the UK. Going to talk briefly about coronavirus and its relation with the eyes and its relation and the connection with ophthalmology. Coronavirus, as we all know, it's a new outbreak and has actually affected us all and has actually made us all to change our lifestyle. However, the connection of the coronavirus issue with the ophthalmology has never been as clear, and we don't exactly know the precise relationship between coronavirus and ophthalmology. Certainly, there are some reports where the person who was infected felt that he contracted the virus through an eye infection based on the fact that he had some degree of red eye, and that was followed after he felt that he had come to a contact with a patient, and that red eye episode followed with the signs and symptoms of coronavirus, and then he was diagnosed with coronavirus. The evidence, however, is not too clear, but it has been quite a bit of a warning sign for most of ophthalmologists, and which made most of us to reduce our work to only essential emergency works. It's important to know that all ophthalmology clinics, more or less, are now open for emergencies, but they are not open for electives and cold cases. But the recent news are promising, and the government seems to be advising to open the theatres soon for the semi-emergency cases. Coronavirus also seems to be one of the important things to consider is the route of transmission. We all know that coronavirus gets transmitted through droplets. So one person who is the carrier of the virus coughs, throws some droplets in the air, another person in front of him can inhale that, and leads to the sequences of the infection, starting from, as we all know, the symptoms of coronavirus, starting from some maybe runny nose, followed by headaches, by temperature, and can also by high temperature, and can also go into bronchitis, and in severe cases can lead to the need to intensive care unit. However, it's also the way of transmission through the eyes. It seems to be through the tears. Now, tears, just like any body fluid, can carry viruses. However, one of the new studies showed that the amount of the the concentration of the virus in the tears is not too high. So that is why whether the tears are an important route of transmission of the virus is not too clear. But there are some surgical procedures, like the very well-known cataract surgery, can generate aerosols. These aerosols are droplets that can carry the virus, and if the patient is infected and you carry on doing cataract surgery for him, you may generate a lot of aerosols, leading to high risk of infection of those in the theatre, including the surgeon, nurses, and the others. And that's one of the big impacts of coronavirus in ophthalmology, as we ended up needing to stop all of our elective cases. The other important and peculiar thing about coronavirus is that coronavirus led us all to get locked down at home, and seems that most of us started to do a lot of DIYs, and as a result, eye injury cases have actually increased by 5 to 6 folds. So this is really important to consider when you do a DIY at home. You first of all don't want injury to your eyes. Secondly, especially where most of these clinics are out of capacity, you don't want to end up being referred and end up needing surgery, which could have been avoided. So please, if you're going to do DIYs at home, make sure you get the proper protection, including goggles and the rest of it. Of course, that's not only for eyes, for other things as well, but eyes are usually more susceptible to little DIYs that we usually do at home. otherwise, so this is a summary of the impact of coronavirus on ophthalmology. But of course, as the evidence comes through, our understanding of the virus and the route of transmission and the risks will continue changing. Thank you.